You are listening to the Beyond the Pain podcast, where Dr. Emil Tompkins and his guests guide you through the latest techniques to relieve your pain and learn how to fuel, move, and think for lifetime wellness.
Hey, it's Dr. Emil Tompkins, and I want to thank you for joining us for episode 44 of the Beyond Pain Relief podcast. We have a really special treat for you today, and we're going to be interviewing Dr. Corey Kirschner. Dr. Kirschner is a licensed, board-certified chiropractic neurologist and wellness consultant. He is the founder and clinic director of Kirschner Health Solutions, a private clinical facility located in Allentown, Pennsylvania. Dr. Kirschner has an interesting history. He's always known he'd become a doctor. He grew up in a family of doctors that instilled in him the desire for healing and helping. Dr. Kirschner attended Life Chiropractic College in Marietta, Georgia, where he graduated with honors in two disciplines as a doctor of chiropractic and his Bachelor of Science in Nutrition. In 2014, Dr. Kirschner completed 4 additional years of intensive coursework, earning him the distinction of Diplomate of Chiropractic Neurology. His Lehigh Valley practice has been serving the needs of patients with acute and chronic pain for the last 30 years. He's always seeking the newest and most appropriate care for his patients, and this has been his guiding principle. His thirst for knowledge has strengthened his conviction that chasing symptoms with medications rather than addressing the root cause of disease is why there is a growing crisis in modern healthcare. He specializes in the treatment of new millennium diseases, which are defined as chronic degenerative diseases like heart disease, thyroiditis, resistance to weight loss, irritable bowel syndrome, chronic fatigue syndrome, fibromyalgia, rheumatoid arthritis, anxiety and depression, and diabetes. The increasing number of people afflicted with these neuromediated toxic illnesses is alarming, and for anyone suffering, the sense of desperation can be horribly debilitating. In his 30 years of practice, Dr. Kirschner has seen a dangerous rise in the number of patients burdened by toxic illness. He has developed a protocol to test and safely remove the toxic buildup of cells, including heavy metals. He is a health partner and mentor who can be trusted to guide you through the required dietary and lifestyle changes, the right nutritional and laboratory support, and prepares complete, easy-to-follow programs that work. He's here to teach us some great things on how to live beyond pain relief. I thank you so much for joining us, Dr. Kirschner. I'm here today with Dr. Corey Kirschner. Thank you, Dr. Kirschner, for spending some time with us at the Beyond Pain Relief podcast.
My pleasure.
So tell me, can you expand upon your bio just a little bit? Tell us a little more about yourself.
Okay, so I am, probably in my bio, I'm one of 8, I'm from a family of 8 kids. Wow. All the boys are there's 7 boys, 1 girl. All the boys are doctors. There are 3 cardiac surgeons, 2 chiropractors, anesthesiologists, optometrists. I was born and raised, bred to get into the healthcare field. I was a pre-med major. I was in pre-med school, and I had an epiphany. And the epiphany was, how did I end up as a pre-med major? And I had this major thought, like how did I go this track of becoming an MD? And I had this waking up experience, and I talked to my brother's chiropractor. I talked to my brothers who were surgeons. And the chiropractor, his answer, when he said he changed people's lives, that resonated with me. And then from then on, I went on track to become a chiropractor.
That's really amazing.
Yeah.
I know when I was just getting into college, I was trying to figure out my direction, and there was a similar journey going on where I was looking at various areas of medicine or various areas of healthcare, and actually I knew I didn't want medicine,
right,
but I didn't know chiropractic even existed until someone had told me, and the light bulb went off.
Right.
That was where I needed to be. So it's so interesting that you have such a similar story. But very unique in that you have all these boys that ended up being doctors. You have a pretty interesting specialty in your office. You do a lot of functional neurology, and tell me about that. What is that?
Well, I've been on a journey since I went to chiropractic school. I've been on a journey on how to deliver the best care possible. And it's the more I do what I do, the more these overarching themes start to occur. So I got involved in functional neurology. I got into something called functional medicine, because underlying always with chronic conditions, there's an underlying thought about what the problem is. I actually have it broken down to 4 areas. And the 4 areas where people have chronic problems from is either they're not getting the right nutrients, they're having toxicity problems, they're having an inflammatory problem, there's not enough activation to the nervous system. It's always one of those 4 categories. If you can figure out one of those 4 categories where a person's having a problem, then you can overcome chronic problems. And that's what got me in these fields. And the more I study, I almost go down the rabbit hole and start getting music in the background. So we can pause this for a second.
No, that's okay. So you have those 4 areas.
Those 4 areas. And the more and more I started studying more functional neurology with Ted Carrick, Datis Karazian, learning how to overcome chronic conditions with either through diet, supplements, chiropractic adjustments, functional neurology, or something. And even that I've broken down into 2 main categories.
Yeah.
Hopefully this isn't boring you too much.
No, this is great.
So what I always thought is when a person heals from 2 things that happen. Either I'm doing something to the patient or the patient's doing something for themselves. And the more we can empower a patient to figure out what's going on and how can they overcome their problems, the more when they go through our treatment, when they get done, they're actually better off. We're leaving them better off after we get done treating them. So my job is to figure out what the problem is, do what I need to do, and also teach a patient how they can do it to themselves so they don't need me. My goal is to have a person have a healthy, happy life, and me becoming obsolete to that particular patient. That's my goal.
It's a good goal to have, and a lot of people have the idea that maybe when they're dealing with something that's a chronic condition like this, even though there was so much frustration, that medicine is potentially the only way. And what you're showing and something that we've been talking about here on the Beyond Pain Relief podcast is that there are ways that you can heal yourself from these chronic conditions. That it doesn't take the really invasive medical procedures that unfortunately fill us with so much frustration anyway. So it's a really refreshing direction that you're going.
I'm sure you see in your practice. I see it just this past week. When we talk about patient,
absolutely.
So I have this patient now. She's coming in for chronic fatigue, brain fog, overweight, joint pain. I'm sure you have patients like that all the time. So she's coming in, and I've been working on her for about 3 weeks. Her husband's also a patient, both doing amazingly well. She's lost a lot of weight. She's feeling pretty good. Brain fog is going away. Digestion is getting better. And then on this past Friday, she comes in the scale, and she gained 2 pounds. And I'm asking her, well, how did she gain 2 pounds? And I know I put her on a gluten-free diet. That's part of the restriction. So she said all I had was like a half of a roll. And I said, and I tried to explain, so she didn't get the idea that even that much can cause, it's not weight, it's inflammation. So we actually had to remove it. Within 2 days, she lost another 2 to 3 pounds. So the point is, where am I going with this? The idea is she's not at that point where she has a full understanding of where health comes from, and that's the mindset we work against. We work against what people's preconceived ideas are, and then the preconceived ideas with what UMDs tell them. It's, you have to rely on cholesterol drugs, you have to rely on pain drugs, you have to rely on diabetes drugs. It doesn't fix anything. All it does is ensure that a person is going to be on drugs for the rest of their lives until they have this waking up experience, and that's our job.
Absolutely.
Yeah.
Well, it's good that you're helping people to address that nutritional component, which is so challenging. Conversations that we'll have with patients at times where we start talking about maybe going gluten-free or getting rid of grains or getting rid of sugar or something like that. And it's amazing the number of times that I hear, well, you can't get rid of my pasta, or you can't get rid of my bread or my sandwiches or brownies or whatever it is. But the question that I ask is, do you want to walk? You can't walk right now. You're in so much pain, or you're dealing with whatever this chronic condition that you're dealing with. What's more important, that sandwich or walking? It's when you really look at what that change in your diet or change in a lot of different things, when you look at what it's going to do, it's really not that painful to make that change. But it might be in our minds.
That's true. And I'm sure once again, you probably see the patient. You and I, we both have the perspective of having patients go on a gluten-free diet or go on a healthy diet, and in 3-4 weeks, all of them coming back and saying, hey, this pain's gone, that pain's gone, so that patients who has not gone through that process doesn't have the perspective of what it even feels like. What I love is when the patients actually have gone through the perspective, feeling great, and then they think that, oh, I must be fine now, and then have the breads again and feel like crap, not feel well. It's I love that response, because now they know they are now empowered. It's not me. It's they know the perspective of what it feels like to feel good. They know the perspective of feeling bad, and then that's it. That's the type of patient that you want.
Well, your health is a journey.
Yes.
Your health is a journey that you never completely get over, that you do all this work to feel better, to function better, and to get healthier. And then we achieve that goal where maybe we're feeling the way that we'd like to feel, and we might think, well, now I'm done.
Right.
There's no done. You're not finally healthy, and then there's
Right.
nothing else you have to do. If you go back to doing the things that you did that got you unhealthy,
Right.
you're going to eventually become unhealthy again.
Best analogy. So you live in a house, you live in an apartment, right? You clean it on Sunday. House is perfectly clean. You like the way it looks. You don't clean it for like a couple of weeks. What does it look like? Which house would you rather live in? So the point is, those things that need to, those things that need to be maintained and keep the attention. If you don't, it needs attention, and you don't put attention on it, your body will decay or degenerate.
Yep.
So that's just a little thing.
Oh yeah, you're definitely right about that.
Yeah.
So, do you feel like, was there any point of struggle before the breakthrough in this functional medicine area that you've been in?
I guess the biggest struggle that I'm still trying to, this is an insurance thing. Okay, my biggest struggle is a lot of patients come in and say, well, my insurance pay for this, insurance pay for that. And in my mind, there's a certain model in my mind that a patient or person needs to go through. Mm-hmm. And it's very hard to fit that healthcare model into the insurance game system. That's my biggest challenge. Yep. And having a patient, seems like people value, when they have insurance, they almost say, okay, my insurance will take care of my health, and almost disregard their health because they're paying insurance for it. Make sense?
Oh yeah.
And then, so that's my biggest challenge, like having a patient value their health enough that they'll actually pay the money, time, investment so they can actually improve their lives. That's the biggest challenge.
Well, and when you think about insurance will pay for injuries, for acute types of illnesses, those kinds of things, or they'll pay for certain chronic treatments that you have to take for the rest of your life. They'll even on their guidelines explain that they're not going to cover things that are going to improve your health or maintain your health, which is absolutely outrageous. You would think that it would save them money if they were improving others' health.
One of the conditions that we take care of is peripheral neuropathy. So we frequently see patients who there's a peripheral neuropathy, like pain, tingling, numbness in the feet. Yep. And then you can have like something called a mononeuropathy. Mononeuropathy is like carpal tunnel syndrome, sciatica, pinched nerve in the neck. And it seems almost even lately, because we've gotten a number of patients who've had like pinched nerve in the neck, and their family MD would give them gabapentin or Lyrica for these conditions. And we know gabapentin and Lyrica they're seizure medications, they're not pain medications. And I'm scratching my head like why doctors would actually prescribe that, knowing that when they come into the office, like a couple of weeks, few adjustments, those problems usually clear up. Yeah. Not the peripheral neuropathy, like the single thing. So I guess it almost seems like, I shouldn't say this I'll say it. It seems like some MDs are almost kind of lazy. It's like they're prescribing a drug that has no business being prescribed to a patient for a problem. Just I don't know. I don't know what it is.
One thing that when I have these kinds of conversations, I'll say in their defense, even though I'm not an MD, so I can't really defend them, they'll give you what they've got.
Yeah.
And what they've got is medication.
Yeah.
What they've got is potential surgery or something. And so when you come in with something, they're going to let you know what they've got. I've got a medication, or bad enough, we can think about doing a surgery, when there's so many more things that can be done, but all they've got are those things. So that's all the patient hears about.
Yeah.
And it's so good that there are people like you, doctors like you, who are getting out there and making a difference and teaching others that there is something that they can do. There is a way, in a natural way, for them to be healthy and to achieve healing of some of these things that we've thought were chronic and we'd have to suffer with for the rest of our lives. So what do you think makes your place stand out in your specialty? Why do you stand out amongst the others?
That's a great question. One thing that makes it stand out, I'm been doing this for over 30 years. As a chiropractor, I think I'm pretty good as far as adjusting the spine. As studying functional medicine, functional neurology, it gives me a big pool of information to use on challenging cases. Yeah. So one of the really cool things that we do in our office, and this probably separates me from a lot of chiros and MDs and whatever, is like I tend to think outside the box for those challenging cases. I'll pull in knowledge or information from a lot of different areas and try things. If a person's not responding to whatever we're doing, we might change something. That'll say, okay, let's try this. Let's think outside the box of what might work. Case in point, I have a patient now who's coming in Once again, peripheral neuropathy. He was having some balance problems. So he said, the pain in his feet is much better. He used to be able to walk 30 feet with pain, and now he's going to walk miles without pain. In fact, his video's on my website now. But he's also, every time you go from a sitting to a standing position, he'd have a little bit of a balance problem. When you wake up in the morning, he'd have a balance problem. So we gave him some techniques and therapies to do that most people use for balance issues. He wasn't responding to that. So we thought, okay, let's think about this a little bit. We did some little checks, and we narrowed it down to he has a specific part of his cerebellum, which is the back part of his brain, is having balance issues. So we have him do this real simple, stupid little technique. Takes about 30 seconds to do. He's tapping on a part of his brain where no one taught me this. It's more like, okay, let's think how the wiring of the body is. Let's think like how the thing works. And we told him this little technique, and he said since he's been doing that, he's about 90% better as far as balance is concerned.
Wow.
So the point is that, yeah, I do all the typical stuff like what most functional medical doctors do, and what most chiropractors do, and chiropractic neurologists, but also you have to think a little bit sometimes. And think, okay, what are the possibilities? And work from that basis. So.
And it's amazing how intuitively you came up with that, because I believe people are developing certain techniques around that kind of tapping mechanism, the EFT and a few other techniques.
Right.
And so to just come up with that is really amazing. And it just shows when you're doing good things, you can pull this stuff out and make a difference for people. So that's exciting. So tell me something here. At Beyond Pain Relief, the podcast here, we're committed to helping our audience, our podcast community, not just relieve pain, but to experience more greater health, weight loss, improved cognitive ability. We want people to get their lives back. If you could give one piece of advice right now that someone can implement today to get their lives back, what would that be?
Okay, so this might sound self-serving. I came out with a book called The Whole Body Cure. Simple, easy peasy, and how to actually simple diet. Buy the book, follow the advice. However, for those who don't want to be spending money on a book, the biggest advice I can give to anybody, the first things that I'll tell a person: knock out the grains, knock out the sugar, and move frequently. Those are the three biggest things.
Oh yeah, that's big.
Yeah, it's huge. It's like it's life changing. I've seen so many people respond from an inflammatory viewpoint by knocking out the grains and moving. And start where you're at. Meaning, if a person's a couch potato all the time, don't run a marathon. From a couch potato, we'll just walk 10 feet if you haven't walked 10 feet before. And the next day, maybe walk 11 feet. Just start where you're at and move beyond that a little bit. So that's what I know that's more than one thing.
That's a great piece of advice. And it's a piece of advice that sounds simple, but the problem is people don't do it.
Yeah.
It may sound simple, but it's actually a little bit of a challenge. But if you do it, it really will make a difference in your health and how your body's working. And that's awesome. So very good advice. And we're going to talk a little bit later here. I'm going to have a link in the show notes for us to be able to figure out how to get a hold of your book, The Whole Body Cure. That's really exciting. So describe your ideal client. Who's the ideal person that would benefit from your service?
Actually, the ideal patient is someone who has been suffering from a chronic condition for years, who has done the medical route, has had all the tests done, and realized they had the epiphany, thinking, you know what, I can't live like this anymore. I do not want my life to not be okay if 6 months down the road I'm living the same way I am right now. I gotta do something different, whatever it is. And that's the ideal patient. It could be peripheral neuropathy, it could be weight, it could be brain fog, it could be brain fatigue, any of those things, any chronic condition. You've had a problem for a long time, you're tired of the drugs, you're tired of the frustration, and you want to do something about it. Not just complain about it anymore, but do something about it.
Yeah.
And that's my ideal patient.
That's great. That's great. It's always good to receive good information. It feels good, and we like to get that information, but you just said something really important. What are you going to do with it?
Yeah.
That's the key. So, you have a book. I want to make sure that we get a copy of that. If I want that, how would I most easily find your book?
Okay, this is the challenging thing. Okay, so it was originally put out through Rodale Press. I believe you can buy it on, and Rodale Press had it. Rodale Press got sold to another company. I think you can buy it on Amazon.com now, I think.
Okay.
Maybe.
All right.
So I'm sorry that wasn't, someone told me you can buy it on Amazon. I haven't actually seen it there, but.
You know what? If you can buy it on Amazon, that link will be in the show notes. So as you're listening, just scroll down the show notes and you'll see a link to that book. You can get that book on Amazon or wherever you're able to get that book. We're going to find it, and that link will be in the show notes. Dr. Kirschner, thank you so much for spending time with us today. Thank you for giving us valuable information to improve the lives of our podcast community, and I hope you have a great night.
Well, thank you. Appreciate it.
Hey guys, it's Dr. Emil Tompkins. Many people fail to make a change in their health until things are drastic, until we've gone so far that it's so challenging to make that change, or we feel like it's almost too late, and then we're much more reluctant to make those changes in our health. This is a problem, and it needs to change. It needs to stop. When you find something that has an opportunity to make a difference in your health or in the health of someone around you, I invite you to take that opportunity to make that change for yourself or for someone you know. So I have a favor to ask of you. If you've listened to this podcast and you feel like there's something here that you think will benefit someone that you know, I invite you to share that podcast with them. There's a share link on the bottom of the screen. I want you to click that share button to share this with others. Give others the opportunity to experience the Beyond Pain Relief podcast. Share that with others. Make a difference in the health of someone around you. And I thank you so much for doing that. This is Dr. Emil Tompkins. Thank you for joining us on the Beyond Pain Relief podcast. And thank you for making a difference in the lives of the people around you. Have a great day.
You are listening to the Beyond the Pain podcast, where Dr. Emil Tompkins and his guests guide you through the latest techniques to relieve your pain and learn how to fuel, move, and think for lifetime wellness.